Welcome to the latest edition of Public Health Updates, covering recent breakthroughs in the field, brought to you by Lucid Quest. Stanford Medicine reports a preclinical advance in osteoarthritis. In a science study, researchers used a stem cell-free injectable inhibitor of 15-prostaglandin dehydrogenase, or 15-PGDH. In mice blocking 15-PGDH regenerated knee cartilage, reversed age-related cartilage loss, and prevented the development of osteoarthritis. Human knee cartilage samples studied ex vivo showed regenerative signaling responses. While still preclinical, this approach represents a potential disease-modifying strategy for osteoarthritis, with implications for future orthopedic treatment patterns pending human trials. A global evidence update reinforces that alcohol is a Group 1 carcinogen, meaning it is causally linked to cancer in humans. Large observational cohorts and updated epidemiologic syntheses find no established safe level of alcohol consumption for cancer risk. Earlier claims of cardioprotective effects are now considered methodologically flawed due to confounding and bias. These findings may influence preventive counseling and public health messaging, while acknowledging limitations inherent to observational data. A BMJ review from the UK examined 37 randomized trials assessing outcomes after stopping GLP-1 receptor agonists. The analysis found that most patients regained lost weight within 2 years of discontinuation, and associated cardiometabolic benefits also diminished. The results raise important questions about long-term treatment duration, patient expectations, and reimbursement models for obesity pharmacotherapy. Real-world data from Scotland highlight the impact of maternal RSV pre-F vaccination. In a case control study published in The Lancet Infectious Diseases, RSV-related hospitalizations in infants under 90 days of age fell by more than 80%. Effectiveness was strongly linked to appropriate vaccination timing during pregnancy, supporting maternal immunization as a high-impact strategy for RSV prevention. In the United States, FDA-cleared and laboratory-developed at-home STD tests are expanding access to screening. These mail-in tests, often paired with telehealth consultations, allow private testing and increasingly remote treatment initiation. While this model may streamline diagnosis and adherence, regulatory oversight, test scope, and linkage to care continue to vary by provider. A Cochrane review of 73 randomized trials involving around 5,000 participants evaluated exercise for depression. The review found that exercise produced symptom relief comparable to antidepressant medications or psychotherapy. However, questions remain about long-term durability of benefit and the most effective exercise protocols. The findings reinforce exercise as a viable first-line or adjunct treatment option. An ecology study from Brazil examined the effects of deforestation on mosquito behavior. Using DNA-based blood meal analysis across approximately 40 mosquito species in the Atlantic forest, researchers found that biodiversity loss shifts mosquito feeding toward humans as animal hosts disappear. This change increases the risk of zoonotic spillover and links environmental degradation directly to infectious disease risk. In China, blood-based Alzheimer's disease diagnostic tests are being rolled out commercially by BGI Genomics and Roche, with regulatory review ongoing. These tests are positioned as adjuncts to imaging and clinical evaluation, supporting diagnosis and disease monitoring. Their introduction may reshape diagnostic pathways and expand access to disease-modifying Alzheimer's therapies as they become available. Stay ahead in public health research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting.